Hello, everyone. Welcome back to Pitt River Health Services series on diabetes and education. And this talk is on the newest medications for people with diabetes. Are they the best? Which ones are the best? So we're going to get into it. I'm Theresa Garnero.
And I'm Stephanie Bouquet, and we are both diabetes educators. I am a registered dietitian, and Theresa is a registered nurse.
Yes, and so we're going to review some of the different kinds of medications and how they work in your body. So in terms of type 2 diabetes, did you know that there are at least 8 known deficiencies that are related? Now, when I say deficiencies, what's another way to say this, Stephanie? It's like things aren't working well, right?
Right. Things aren't working as well as they should.
Yeah, so the arrows here, the red arrows up and down, that just means if your blood sugars go up or down in relation to these known areas of issue in your body. So a lot of times people will say, well, I've got type 2. It's my fault. What did I eat? But it's much more complex than that. So like, I'm just going to highlight a couple of these. The issue with the liver, which we talked about in a recent lecture, is that the liver puts out more sugar, and so the blood sugar goes high. The kidneys, they have issues with reabsorbing the glucose, so the glucose goes high. And then the fat cells are involved too. And then there's less of the hormone in the gut that helps to control blood sugar. It just goes on and on. Less secretion or less output, less available insulin, the hormone that helps to lower blood sugar. The muscles don't absorb the sugar. It just goes on and on. So the whole point of this slide, it's kind of busy, is just to know this is not your fault. If you need medications, then this is why. There are medications, which you're going to see here shortly, that target each of these areas. And I like to compare this to other endocrine type issues, specifically thyroid, right? If your thyroid is having trouble, you take a hormone for it. Do you beat yourself up about it? Like, oh, it's my fault and now I have to take a hormone. No, it's a hormone. If your ovaries are on the fritz and you need a hormone to help them nudge them along, then it's not your fault. Okay. So, Stephanie, I know I've been blabbing here. Do you have any comments?
Well, I just think that the way that society perceives someone that has diabetes, it's a shameful thing, and it shouldn't be that way. It's not your fault. You can see here, it's the entire body really plays into it. So I always like to assure people that, gosh, medications is just another tool. It's just like managing your diet or exercising. They all work together in the toolbox to make the body work the way it should, so we don't see any bad effects.
Okay, so I have a few slides from Dr. Ralph DeFronzo. He is renowned in the field of diabetes, and he actually has shown what transpires in these various organs and whatnot. So obviously, if your pancreas, this is a little cartoon of a pancreas. If your pancreas isn't putting out enough insulin, whether you have type 1 or type 2, and you need to take the hormone insulin, then so be it. There's a lot of research on that it should be considered if there's not ongoing, well, it should be considered if there's weight loss that is not something you're trying to do, and or your A1C is above 10%, then insulin is started. Or if you have glucose levels above 300, your pancreas is in a toxic environment, and so insulin is needed. Now, this next one, metformin, is one of the more common ones. It's been around for decades. You've probably heard about it. It is used also for the prevention of type 2 diabetes, or those who have a high risk for type 2 diabetes, those who are have a BMI that's a body mass index above 35, or a fasting blood sugar above 110, or an A1C above 6%. But And also, those who have gestational diabetes or had gestational diabetes, or in other words, blood sugar went up during pregnancy. But as of this recording and the end of 2022, no agents have been approved by the FDA for diabetes prevention. Hopefully that's going to change, but just wanted to mention that. Also with insulin, it can be injected, it can also be inhaled, but I'm going to focus on some other pills and injectables that can address these areas, just to kind of paint a picture of how this works and why medications are a very important tool. All right, so this thiazolidinediones, that's a mouthful. So we call them TZDs for short. I'm going to review some of the names of these medications, but again, I just want you to sit back and see how these different medications target different areas. So this helps to increase the secretion of insulin. It helps to decrease the liver's output of sugar. It also helps the glucose to be absorbed by the muscles. And it helps with the process that's going on inside the fat cells. So essentially, if you're on a TZD like pioglitazone or Actos or Avandia, it's working in 4 of the 8 known deficiencies, if you will, or known problems. If we move on to this group of medications called sodium glucose cotransporter 2 inhibitors, aka SGLT2 inhibitors, or SGLT2Is, they target many of these areas as well. So you actually, sorry, I clicked through that too fast, but here are 3 different areas that they target. So you're getting a fair amount of bang for your buck. And I'm going to talk about the names of those in a moment, and maybe you will recognize them. And this last group is the glucagon-like peptide 1, or GLP-1. And this is something that is in deficient supply. It's a type of hormone. And you could take this either in an injectable form. It is not insulin. You could take it also in a pill form. And as you can see here, it addresses 6 out of the 8 known problems that come with type 2 diabetes that lead to hyperglycemia. And one of the things that you might be wondering right now is, what does all this mean? And really, this is up to a savvy healthcare provider, diabetes care provider, to really drill down what's going to work best for you. But some of the newer medications fall into these 2 categories, the SGLT2 inhibitors, so you can read through this list and see if anything strikes a bell. And then the GLP-1 receptor agonists, and there are several here. There are new ones coming out all the time, so this might not show by the time you watch this others that are currently available. The beauty of these particular medications is the new research that's coming out about how it's cardiorenal protective. So it protects your heart and your kidneys. I'm pointing to the kidneys back there. And so, yeah, that really is changing the way we think about prescribing medications, because of how it protects the heart, how it protects the kidneys, which are known problems if high blood sugar continues without, being managed. So again, there's hope for this. If you've got high sugar, if you have kidney issues, there are medications that are there. Reminder, sometimes I feel like we have similar messages here, because there is a thread through all of this. This is not your fault. You have tools available to you. Talk with your provider. Your pancreas isn't functioning like it was before, and medications need to change. So don't be shy about asking. If you need more medicine or a different medicine or an additional medicine, it's because your body needs some help. And I'm also, we didn't get into blood pressure or cholesterol medicines. The new guidelines say blood pressure is considered high blood pressure when it's 130/80 and above. So it's important to also be sure that you're on the right medications for those conditions that tend to come with diabetes. Yeah, of course, you know, your pharmacist has a wealth of information about what's going to cost less, what might belong to the same family of medications and be easier on your pocketbook. Stephanie, any final thoughts?
Well, I just wanted to point out something that you had mentioned, and when you were showing the list of medications, is there are a lot of options. And if you're wondering, well, why am I on this, or why am I on this? Why did he have, why he or she, the physician, added another medication? Just kind of think back to that busy graph of the body, that there are a lot of different organs that can benefit from the different kinds of medications. So you're right, it takes a very crafty or knowledgeable provider to be able to give you the best form of medication and make your body the healthiest. So again, there's no shame in that. We want to make sure that your organs are working as well as they can.
Mm-hmm. And then also making sure that you're taking them at the best time, and that your consistency with taking them is 80% or higher, because we all know a lot of, like, at least half of the people who take medications don't take them as prescribed for one reason or another, whether it's forgetfulness or it's too expensive or you don't like the feeling or you're feeling better now, so you stop taking them. There are many reasons. So being consistent is going to help your body as well. And if for some reason you're not taking your medication or you don't want to take it, have that conversation. You know, I didn't continue with glucophage. I didn't continue with metformin because it gave me a lot of gas. You know, you want to have that discussion, and then maybe you didn't realize it's best to take it at the end of a meal. You know, so there are little insights about the timing of the medication and how you can remember to be consistent, because that's just going to help your body overall.
Makes sense.
Yeah. All right. So really appreciate your attention. We look forward to seeing you next time.
Bye.